Welcome to the Caregiver Relief Podcast. I'm your host, Diane Carbo, RN, and today we are talking about something many seniors and family caregivers notice, but may not always know how to interpret: changes in aging skin. As we get older, our skin becomes thinner, drier, and more fragile. Years of sun exposure can begin to show up as brown spots, rough patches, discoloration, bruising, or changes in moles. For many older adults, the question becomes, is this just an age spot or could this be skin cancer? Today, I'm joined by two women from Purvis Dermatology here in Myrtle Beach, South Carolina, who are going to bring both medical and aesthetic expertise to this conversation. Morgan Kelley is a family nurse practitioner and Myrtle Beach native. She earned her undergraduate nursing degree from Francis Marion University and her advanced education with a family practitioner degree from Loyola University in New Orleans. Morgan has a deep passion for dermatological care and is committed to helping patients maintain healthy skin through prevention, education, and treatment. And we are also joined by Hannah Hewaij, a clinical esthetician who joined Purvis Dermatology in 2025. Along with her South Carolina aesthetics license, Hannah has completed advanced aesthetic certifications and is trained in lasers, medical-grade chemical peels, RF microneedling, dermaplaning, microablation, dermabrasion, lashes, and brows. She is dedicated to providing safe, professional skincare treatments and lasting cosmetic results. This episode is for seniors, for family caregivers, and anyone who has ever looked at a spot, rash, mole, dry patch, or skin change and wondered, should I get this checked? This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Ladies, I know it's the end of the day. You're anxious to get home, so I really appreciate you taking time to do this, because I'm 73 years old and I'm seeing all my friends are all going to the dermatologist and having skin cancers removed. And some of them are having these Mohs procedures, which we can talk about later, but they're having a lot of skin removed. So we can't take for granted our skin. So I want to thank you for being here.
Yeah, thank you for having us, Diane. That was very nice.
Yes. Before we get into the skin cancer and age spots and treatments, would you each share what drew you into dermatology and skincare?
I'll go first. This is Morgan.
Okay.
So I actually experienced a skin cancer when I was in my teens. I had a basal
wow.
cell skin cancer. I did indoor tanning, and so it kind of prompted me to start studying the skin outside of what I was learning just in my regular nursing education and be more preventative. And then it just became a passion of mine.
Yeah. And then as Hannah's speaking here too, something that definitely got me interested in becoming an esthetician. I have a family history of skin cancer, and I've just always grown up with the fascination of skincare and skin products. I definitely grew up in a generation of time where technology was right in front of everyone's face. So it's definitely something we saw all the time. And I was just super grateful to have a lot of knowledge and upbringing with that. And so that's definitely what got me interested in what it is that I'm doing.
Morgan, many seniors grew up before sunscreen was part of daily life. I used to put baby oil on. Oh, lay out in the sun. But I'm very fair. I quit that very early in my teens because it didn't do well. But what are some of the most common skin changes you see in older adults who have had years of sun exposure?
For those that have used baby oil iodine, oftentimes we do see what we call lentigines or sunspots, and they're flat brown spots that can show up on the skin. These do have the risk of evolving, so we watch them like we would watch a mole. Of course, you can develop new moles, but there is genetic predisposition to acquiring moles as well as seborrheic keratoses. So these are more so raised growths on the skin that are typically so they are harmless, but we always recommend here that patients call us if they do see any new changes or growths on the skin because sometimes melanomas can mask themselves as those things. So we
Yes.
do to monitor any new growths. But those would be the most common things that we see here.
Can you explain the ABCDE warning signs of melanoma in plain language for seniors?
Yeah, so A stands for asymmetry. B is border, so any irregularities in the border. C is coloration, so multiple colors in one spot. D is diameter, so it's a 5 millimeter or greater. That would be bigger than the back of a pencil eraser.
Oh.
And then E stands for evolution. So anything that's changing. And I always hit home with that one. The changing lesions are the ones that we really watch for the most. But of course, if you did wake up and you suddenly had a lesion that was greater than 5 millimeters, then we always advise getting you in here quickly to have it assessed.
Now, you have mentioned actinic keratosis. Now, can you
Yes.
explain why seniors should pay attention to the rough, scaly, or crusty patches on sun exposed areas like the face, ears, scalp, hands, neck, or lips?
Yes. So the actinic keratoses, they are considered pre-skin cancers, and usually they're like a red or pink scaly area. They can feel tender to the touch as well, and we only see these in sun exposed areas. They have about a 1 in 4 likelihood of turning into squamous cell skin cancer. So we do make sure that we get rid of these whenever we see them in the office.
Morgan, could you talk to us about when should a senior make or a family caregiver, anybody listening right now, make a dermatology appointment instead of waiting to see if a spot goes away?
The recommendation by the American Academy of Dermatology is any concerning lesion to present it for a skin check or evaluation. And then typically from there, we usually advise living in our area at the beach to be seen either every 6 months or once a year for maintenance.
I know since I've moved here, I'm seeing you guys a lot more than I thought I would. But it's really, I can tell everybody, my listeners, Morgan is my dermatology practitioner, and she has helped me get through and identify some issues that I had. And I'm very careful because I've always avoided the sun for the most part. But here I am, 73 years old, and I had a spot on my head. I had no idea what it was. And I asked my hairdresser, and he says it's ringworm. I said, no, that's not ringworm. And I decided I can't wait. I needed to get in, and you were able to treat it right away, which was really important for me. I hated it was making me crazy, worrying that something was wrong. Now, many caregivers help with bathing, dressing, wound care, or applying lotion. This is the time when they can check their loved one's skin and look for different skin changes. What kind of skin changes should caregivers report to a healthcare provider?
I always recommend any changes. So we think about those ABCDEs, but then also we consider things like if there's sensitivities in the skin, if you have a new painful area of the skin or itchy area, I always recommend that patients get that assessed as well.
Now, here's a problem because I have old lady skin right now. Dry, itchy skin is very common in older adults. What causes it, and what simple steps can seniors take at home to protect their skin barrier?
So finding a good moisturizer, one that you'll be consistent with. I don't really recommend one over another, just it's whatever the person tolerates, whatever you can use consistently. And then a bar of soap is what I recommend. A bar will help strip less lipids from your skin, which can cause that dryness and itchiness that you feel. This is also another reason that you are predisposed to that drier, itchier skin. But of course, we want to make sure that it was nothing internally causing that as well. Although there are changes that naturally occur that do make the skin drier and just more itchy.
Yeah, I lotion myself twice a day. As I've gotten older, I've had to, but I hate looking at my skin and seeing how frail, and it's like rice paper thin right now. And it's, whoa,
Mhm.
I've taken care of people forever, and I wasn't prepared for this for myself.
Yes. Yeah, and the reason we get thinner skin is we lose collagen in our skin. It starts to deplete in about the mid-20s and every year thereafter. So collagen acts like the shock absorbers to the skin. So that's what makes it feel thinner. That's what makes you bruise easier as well.
I've
Um,
always bruised easy. Now, I have a question. You're saying we lose collagen. Should we be, I feel like it's too late for me for the collagen supplements, but should we be considering taking a collagen supplement very early in our lives?
There's not any literature currently that links
Gotcha.
early
That's what I thought.
collagen intake, but
Yeah.
yeah.
Okay. I just wanted to check because I thought that what I could find is that it wasn't effective. So I wanted to check and see from a professional if I knew what I was talking about.
Right. Yes.
Now, Hannah, many older adults want to look refreshed but are nervous about cosmetic treatments. What aesthetic treatments can be helpful for aging skin when they are done safely and professionally?
Yes, so I definitely think that's something we certainly want to be cautious with. And when we're introducing any type of cosmetic treatment to the skin, we want to make sure we're taking a gentle but effective approach. I love to refer people to our signature facial we have here at the office. It's called the Diamond Glow Facial. And this facial works to extract, exfoliate, and infuse the skin. So it's gently extracting and exfoliating any dry skin cells and buildup that we may have on our face while gently infusing a hydrating serum or custom serum to whatever the concerns may be. That's a very effective facial from teen acne all the way to aging skin with collagen loss that I tend to see wonderful results with. And I can treat all skin types and skin conditions with this facial.
What age would you recommend a person have that type of facial?
Yeah, I see all sorts of age ranges with it. I like to see people, I'd say every 4 to 6 weeks for a facial, if that's something you're able to do for maintenance. But for an age to start, I see people who start in their early 20s all the way up into, I see the people who are in their late 80s, I would say, that I
Yeah.
treat this facial with. So there's really not a specific age that it caters to, but thankfully we're able to treat bunch of different skin types with it and concerns.
Now, how do you decide whether someone is a good candidate for treatments like chemical peels or lasers or microneedling, dermaplaning, or hydrodermabrasion?
Yes, that's why I love consults. I love just getting a little bit of history, history of any skin concerns and skin conditions. Also, what may be any family history, just so I know what type of sensitivities someone's skin may have before deciding whether or not they would be a good fit for a chemical peel or a laser treatment. We like to always say, treat people conservatively but aggressively. I like to make sure you're getting results and you're pleased with the results you're getting, but I don't want to overtreat the skin types. I normally love to consult people, and that would include a good thorough look at the skin and hearing about what type of products you're using on the skin, what you're sensitive to or have been in the past. That's why I always love to tell people if it's something that you're interested in doing, definitely consulting with your provider beforehand. What next steps would look like is the best way to start.
Are there treatments or products that seniors should be cautious about, especially if they have thin skin, fragile skin, diabetes, poor circulation, or a history of skin cancer, or they take blood thinners?
Yes, I mean, there are definitely some things I say you don't want to over exfoliate the skin and be cautious with any type of retinols on the skin. They're very helpful when they're used correctly, but they can definitely be overused and that can cause some sensitivity when you're looking at skin types that are pretty sensitive and prone to redness or irritation.
I have very fair skin, and
Mhm.
I tried the retinol products when I was younger, but I couldn't I had one of the things I absolutely had to do to be careful is wear sunscreen all the time over it because it really made me very photosensitive when
Yes.
I was out in the sun, and people don't realize that. And that's one thing that I have learned is the importance of sunscreen
Yes.
and wearing
Mhm.
it and reapplying it if you're out. I actually wear because my arms are so fragile right now, I actually wear I don't have tattoos, but you know the sleeves that they wear to cover their tattoos?
Oh,
I
yeah.
actually wear those because 'cause I'm around dogs too, and they scratch me and I bleed in a minute or very easily. So I wear those to help protect my skin when I'm out driving and stuff. And I know people think I'm silly, but I don't wanna take a chance, so and because we are in Myrtle Beach, I get
Mhm.
out early. I'm not a hat person, but I make myself wear a hat when I'm on the beach, but I don't go out in the heat of the day. You know, one of the problems I have here in Myrtle Beach is they don't open the pools usually till around 9, and I like to be in the pool at 7:30, 8 o'clock, do my workout, and in the outdoor pools, and because we don't have many indoor pools available to us in the area unless you drive really far. Because I would prefer an indoor pool any old time to work out because it's so much better for my skin.
Oh, yeah. And I agree with what you're saying. It's definitely important and it's never too late to start working to protect the skin. I
Yep.
definitely love to tell people the good thing is you have a wonderful product that we have access to that you can buy over the counter. That's the number one anti-ager and it's sunscreen for sure. And reapplying it. And like you said, wearing a hat, we don't think about our scalps all the time. So we get older and our hair starts thinning and it's, oh my goodness, all the times I pulled my hair back so tight or laid out on the beach and didn't have a hat or protection over my scalp. That can definitely be places where we see a lot of concerns as well too.
Yes,
Like you
and that spot on my head that Morgan treated, it real made me realize, "You gotta start wearing a hat, girl. You gotta get over the fact that you don't look good in a hat, but you gotta wear one anyway."
yes. Oh yeah.
And
For
at 73, who's gonna notice me on the beach anyway?
yeah.
Morgan and Hannah, what would you both say to a senior who feels embarrassed about their skin or who has delayed coming in because they're afraid of what the provider might find?
Well, the earlier detection, the better. And for the most part, most things skin related can be treated even if they are delayed, with the exemption of some skin cancers. But there are more systemic therapies in those cases as well. Delaying unknown doesn't necessarily delay outcome. Typically, our response is that patients don't feel it's as bad as they were anticipating once they come in to meet us. But yeah.
Yeah, and it's very important, at least where we're at, being super thorough is something that we are grateful that we get to do. And like you said, if somebody's coming in, we're making sure we're checking head to toe and addressing all of your concerns and seeing if there's anything more that we can find to help guide you and get you the help and products or treatments it is that you need to be preventative or address whatever the concern may be.
I have friends that delayed and delayed looking at their skin and going to the dermatologist. And one of the things that occurred that surprised me was the what looked like a small spot ended up being huge. Morgan, can you talk about the Mohs procedure?
Yeah, Mohs is a micrographic skin technique, a surgical technique that is used to take the least amount of skin while still ensuring that all of his skin cancer is removed. So here at this office, we offer Mohs surgery for basal cell carcinoma and squamous cell carcinoma, which are the most and second most common type of skin cancers. We usually reserve Mohs surgery for lesions that are greater than 2 centimeters or in high risk areas. So, like on the head, neck area, or are recurrent. So, if we've seen one of those skin cancers that comes back after it's already been treated, then we will use Mohs surgery for it. But the positive thing is Mohs, you do know that the skin cancer has been removed by the time that the procedure is over. It is all done on one day and tissues processed in-house as the procedure is ongoing. So Dr. Purvis is our physician that does offer Mohs surgery. You want a provider that is Mohs certified. So he will take the tissue, processes that in our lab, and then reads it under the microscope and is able to tell if there's any skin cancer cells near the edges or base of the specimen. And he determines if he has to go back in for another cut based on that. So it can be a lengthier procedure, but it has a very high cure rate to it.
I'm amazed at the results after
Yes.
the Mohs procedure. I have several clients that have had Mohs, and one, it took all day long because they thought they got it all, and each time they had to go back and do just a little bit more. And while people are impatient and want to get it, want to go home, it's better to get it all cleared up right away and know that you're going to be healing and on your way to recovery faster.
That's right.
Oh, yes.
Yeah. What is one skincare routine you would recommend for older adults who feel overwhelmed by all the products and advice online?
My typical approach is a gentle cleanser. So you want to do twice a day gentle cleanser, a gentle moisturizer. I always recommend that a patient has some sort of a retinol on board. This helps with cell turnover on the skin, so it helps prevent aging. I am very into peptide creams right now, so I have been recommending peptides to anybody that's over the age of 30, really. And then hyaluronic acid for very dry skin. So that's going to help to plump up the skin or plump up the fine lines and wrinkles. Those are my 3 favorites.
Yeah.
What is it? Oh, I'm sorry, Hannah. I was going to
No,
ask you
yeah.
next, but
Yeah.
I just wanted to know, what is it about the peptides that you like? Tell me about that.
So peptides kind of act like almost like a Botox in a bottle. So that's a less invasive procedure for just kind of smoothing out the skin texturally. It does help to give you a bit of a glow, but it is replenishing those peptides that are in the skin. So essentially, it works hand in hand with the hyaluronic acid
Okay.
and retinol.
And Hannah, what do you recommend?
Yeah, similar to what Morgan was just saying, I definitely like to tell people I love taking the approach of less is more, especially if we're starting out. If you're doing something, then that's a step in the right direction. But like she said, a gentle cleanser twice a day, and then a moisturizer and sunscreen. And in the evening times, I do recommend definitely some type of exfoliant. I see a lot of people whose first thing they're telling me is their skin is dry and they want to moisturize it and they're overcompensating by just trying to moisturize. But a lot of times it's a lack of exfoliation. So I say at nighttime, doing some type of gentle cleanser and exfoliant, whether that's a retinol. There are even some type of exfoliants out there that are a less aggressive retinol or a plant-based one. So you can really be using all skin types should be able to tolerate some type of exfoliant, and then a moisturizer as well. Moisturizer is a great way to keep the skin hydrated and leave a good protective barrier over the skin as well too, as we're putting all these products on.
Now I'm going to ask you a question about the moisturizers that have sunscreen in them. Is that enough, or do you recommend absolutely putting another layer of sunscreen on?
The recommendation is SPF 30 or greater. So if your moisturizer has SPF 30 in it,
Okay.
then that's okay as a baseline. You want to reapply it every 2 hours when you're outdoors. And then wearing a wide brim hat is the other thing that is recommended by the American Academy of Dermatology. I have patients that will use moisturizers with sunscreen in them with their SPF 30. And then I just remind them get a 30 SPF, or my favorite is a tinted sunscreen. That's what I personally will wear. And then just to be reapplying either the tinted, or there are mineral based powdered sunscreens as well. So a lot of females do prefer those just as their reapplication goes. We have a wonderful sunscreen here. Actually, it is a tinted sunscreen that can act as a moisturizer, and it actually has a peptide in it too. So it has multi benefits to it. There also is a DNA repair enzyme in it, so it helps to reverse photo aging in the skin.
That's amazing.
Yeah.
Now, should people put sunscreen on their ears and the back of their neck? I know that everybody wants to take care of their face, but
Yeah.
that's someplace I've seen a lot of my clients have ears that have had the Mohs procedure or something cut out. They're missing parts of their ears because they didn't put sunscreen on them.
Yeah, so you want to protect any skin that you don't want to develop a skin cancer in, essentially. So, yeah, I would recommend putting sunscreen on top of the ears, behind the ears, and the wide brim hat helps with that too when you're out and about. But if you're going to run errands and running into a building, then obviously some people won't want to wear that. I just recommend having that good base coat all over the exposed skin
Yes.
is good. Yeah.
I always say you can see people's age from the elbows and the hands and the neck. And so something I always recommend is go down on your neck, go over the tops of your hands with any excess you have left over. Definitely make sure you're applying that anywhere that's going to be exposed to the sun too. Because like you said, a lot of times we'll want to put it onto our face, but we're not thinking about our neck. And so it's almost just kind of like your business just on the face and then party everywhere else. So we definitely want to make sure we're protecting it all.
And you know what? I have to tell you what I learned here in being in Myrtle Beach is you got to do your tops of your feet if you're wearing sandals.
Definitely.
Oh yes, you'll get
Yeah.
the sandal straps in the summertime with how hot and how much sun we get here for sure.
Yes, yes. And because I do burn easy, I definitely cover everything with sunscreen. And I hate wearing sunscreen because it just attracts all the dirt. But if it keeps me feeling better, that's okay. I just shower it off at night, or reapply after I get into the water or whatever. Ladies, do you have anything more you can share that I might have missed?
I think that you've covered the basis of everything that I usually recommend in the office. We do tailor skin checks based on if you've had pre-skin cancers or malignant lesions. So any skin cancers, we do see patients more frequently in those cases. But in general, we recommend here at the beach at least once a year seeing our patients. And so we're welcome to anybody that needs a skin check or has any lesions that are worrisome.
Yes.
Well, we have a shortage of dermatologists in the country, and it's desperately needed. So I appreciate all that you do. So, how do people find Purvis Dermatology and talk to you guys if they need to reach out or make an appointment?
Our telephone number here at the office, you can always reach out and book an appointment at 843-887-7546. Or we have a website. We're not currently offering appointments to be booked on the website at this time, but our website is purvisdermatology.com.
Yes. And if you ever have any questions or anything, we have a lot of great helpful information on our website as well too. So I definitely say refer to our website and definitely give our office a call if you're looking to book with any of us. It's never too late, and we're here as your professional guidance with any questions and concerns you may have. We're honored, and it's a privilege to get to work with the people we do every single day.
I love what you guys do. I love coming into your office. You always make everybody feel special and beautiful. And that's nice because I was told that women my age are invisible, and you don't make me feel invisible. So I appreciate that. Thank you.
That's
ladies.
so kind. Thank you.
Thank you, ladies, so much for sharing your valuable information. I really appreciate it.
Of course.
To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself, practice self-care every day, and look at your skin and go get taken care of if you need to, and wear sunscreen because you are worth it.